today's event is one of a kind. This is geared towards the health sector, mainly, so you can imagine why I was given the opportunity to chair this occasion. We are very thankful to Professor Frank, Dr. Rasha, and Her Excellency, the First Lady of the Republic of the Gambia, Madam Fatou Barrow, and the other First Ladies who came around to grace this occasion. We've had their inputs, we had the strategies they've been carrying out, but I think you must agree with me that this morning, of course, we thank His Excellency, the President of the Republic, Mr. Adama Barrow, who was represented by the Vice President, His Excellency. But I guess you'll all agree with me, this morning we had some very influential people, very powerful people, the First Ladies of the various republics. You don't agree with me? Do you agree with me or not? You see, when they are not happy, we are all in trouble. You know that. And when they are happy, the countries flourish. Do you believe that or not? Well, the women here know. With all our mature stature and whatever we do, when the house is not in order, we might get to work and start quarreling with everybody, isn't it? So, but fortunate, we are also very fortunate that in their minds they say they cannot also be happy if the people of the countries are not happy. If maternal mortality is not reduced, if under 5 mortality is not reduced, if the infertile women go through the challenges that many African women go through, if the girl child is married at an early age, if there is female genital mutilation, if there is domestic violence, they cannot be happy. So you see, there is a lot left for all of us to be very happy together. But the good thing is, we've seen their strategies, their endeavors in ensuring that these things happen in our various countries. We have seen the remarkable input. All the First Ladies are doing something to ensure that their people get the best of care, especially in the health sector, especially when it comes to women's and children's health. In the Gambia, I've been a witness to that, so I can say a little bit more about what our First Lady has been doing here. Before she became First Lady, she used to get her meager resources to walk into the hospital, to go to the neonatal unit, to support the women who are taking care of their neonates. Some of those women would have come from very far in the hinterlands of the country, and she supported them. Then I don't think she herself knew she was going to be First Lady. Probably at that time, only Allah knew that she's going to be First Lady. So she started very early. And I think that's remarkable. At some point, I was also the Chief Medical Director of our teaching hospital before I became Minister for Health. She's been in and out of the hospital supporting us. Currently, her foundation is constructing 3 maternity units in various health facilities in the country. And in the Gambia, we developed a strategy whereby the delivery rooms now are self-contained. That means one woman in labor to a room that is fully air-conditioned with a bathroom and a toilet. That is dignity. And these facilities she's building are all like that. And just a month ago, the foundation started the construction of a modern emergency center, accident and emergency unit in one of our general hospitals. So she's doing quite a lot. But dramatically, just to recap, there are a lot of things we could go ahead, go on saying. There was a time she walked into our major hospital, the teaching hospital. She went around on inspection, and she thought the toilet was too dirty. The toilets, First lady checking toilets in a hospital. Then she called her team to bring her cleaning materials and gloves, that she was going to clean the toilet of the hospital, the toilets. Well, if the first lady starts cleaning toilet, what will the minister wait for? We rolled our sleeves. The protocol officers, my own team, the directors, all of us, we started cleaning toilets. So, but that shows the passion and the modesty. That's leadership by example. That shows that we have first ladies who are really geared towards improving the lots of the people. And I think we are optimistic if we have this kind of leadership. And even though they are not here, but we want to extend our sincere appreciation and gratitude to them by giving them a big round of applause. A lot is happening in the sectors, and we are going to elaborate more. By the way, I'm chairing this panel discussion, but very soon I'll hand over the mic to the moderator, and I will be a panelist myself. Interesting, isn't it? But we are very appreciative. We've seen what the Merck Foundation has done for capacity building in the sectors, especially the health sector. The output, the care the patients get is highly dependent on the capacity, the skill of the provider. We can only give what we know. So if there are capacity gaps, if there are skill gaps, that means those patients are not getting the best. That is what the direct implication. So if we are able to build capacity, if we are able to train people more in the various aspects, diabetic care, care of the hypertensives, oncology, neonatology, whatever it could be, that means those patients with those problems, when they come to our clinics, to our facilities, they get better care because now we know more. So that's the importance of this. So we are very happy that we have alumni from across Africa, and our Gambian group is there. But I don't know why you are not mixing. You are supposed to mix, not to segregate. Some there and the others here, no. So I hope you have the opportunity to interact, because that's the essence. So we exchange ideas here and there. At this juncture, I know there's a lot to discuss. My colleagues have been very kind enough to be part of this process. We have, as your moderator, or as our moderator, the legendary Sarah Opendi, for those of you who know her. This is a phenomenal woman. I've encountered her numerous times, but these are some of the powerful women in Uganda. Is it not true? Those from Uganda. I have seen her talk in fora across the world, and I've seen her talk in Uganda. But for those of you who might not know, there was a time I didn't tell her I know this, but I'm going to say it now. We had lunch together, but she didn't know I know this, and I'm going to say it. There was a time there was a viral video going around the world. A minister dressed in hijab and went to a health facility and disguised as a patient because there were problems. There was malpractice. Did you hear? Did you remember? She's the one. So, Sarah, this is an ambush. You didn't know I even know that. So she dressed up in a veil, covered her face because there were problems, and then patients were being maltreated in that facility. She went and pretended to be a patient. So I watched the video. Even this morning I saw the video again, I laughed. So, and then she was treated in a bad way, just like other patients, how other patients were treated. And before they knew, She is the one. So we all have to be careful. Sarah, when anyone comes to any clinic I sit in now, I have to be careful myself, just in case, it is someone like you. But what that teaches us is to treat everyone well, whether it is a minister or is someone from anywhere from the farm. We are all human, and patients are patients. So at this juncture, we thank you for your commitment, and I hand over the mic to the legendary Honorable Sarah Petty. Thank you very much.
Thank you very much, Honorable Minister. You have unveiled me. That video earned me a global award, which I received in 2020. And by then, I was moving to the Ministry of Energy and Mineral Development, having served in the health sector for 7 years. And maybe what I can say is that that's what leaders are there for, to listen to the cries of the people and find solutions. The solution for me was to have first-hand information on what was actually going on in this referral hospital, where money seemed to be the order of the day. And I was asked for money and told, if you don't have money, go. So I pulled some money, which I had marked, and went through the process. But anyway, at the end of the day, the people were arrested, and it created some sanity in that health facility. So back to why we are here, allow me first of all to thank the First Lady, the government of the Gambia, for the warm hospitality accorded to all of us guests who have come to the beautiful country of the Gambia. I was here first last year, and I met the crocodiles and touched them. Quite amazing. For us in my country, crocodiles eat people. But in the Gambia, they don't. Congratulations for that. Honorable Minister, starting with you, and especially where you stopped, talking about the First Lady going into the hospital to clean the hospital. You are all aware that Africa grapples with infectious diseases, and hospitals are supposed to be places where people go for treatment, but you don't go to the hospital and move away with other diseases. So we need to applaud the First Lady for that initiative, leading by example, but it's also a call on all of us to leave these places clean, because we are the ones that dirten them. So that said, Honorable Minister, as a sector, you have talked about the capacity building programs in the health sector, but I want to find out from you, as the Sector Minister for Health and Social Welfare in the Gambia. The Gambia grapples with infectious diseases, just like many other African countries. So what are you doing to ensure that you've come up with homegrown solutions to deal with not just the infectious diseases, but also the non-communicable diseases in your country? You're aware that research is important. So what is it that you are doing to promote research in the Gambia?
Thank you very much, Honorable Sarah. I think what is important in our context is health system strengthening. When the health system is strong, it's able to deal with infectious diseases, is able to deal with non-communicable diseases, and is able to deal with entities like mental health, for example, which is coming to the fore now. Now, of course, we've seen the trend, the global trend, which is also the same in the Gambia, whereby the non-communicable diseases are overtaking the infectious diseases. many of our countries are able to a large extent, deal with diarrheal diseases, with vaccination, with immunization strategies, rotavirus vaccine, and so on and so forth. Respiratory infections, even though they exist, comparatively on the decline, and malaria itself, which is a major problem in many of our regions. But we're now seeing an increase in diabetes, hypertension, and so on and so forth. So that is very important. Cigarette smoking, sedentary lifestyles, poor management of diabetes, poor management of hypertension. These have been big challenges in many of our countries, having patients come to the hospitals with a stroke when the high BP would have been missed in the first place. So strategically, we are doing quite a lot. Research is important, but it goes along with other things. What we are doing, we are building more and more health facilities. Within the last 8 years, we have built 16 health facilities, new ones in the Gambia. That is remarkable. 2 are yet to be completed. It will take it to about 218. In the next 1 to 2 years, we intend to build another 10 health facilities. We are expanding a lot of other health facilities, upgrading them, renovating them, modernizing them. The teaching hospital is one of them, the polyclinic, and a host of other hospitals across the length and breadth of the country. So this is remarkable because whatever we say, the access has to be increased. Without access, I mean, what can you do? You cannot provide the services for the people. Equally speaking, the government and partners are procuring and have already procured a whole lot of diagnostic equipment, CT scanners, respecting some MRI equipment, fluoroscopy, mammography machines, and so on and so forth. So a lot is happening. But of course, all that said and done, if we have the hospitals and equipment without the people, the adequately trained people, then they will just be white elephants. So we are doing all three together. Build infrastructure, modernize the old dilapidated ones, get equipment, train people. And you can see this is evident today. We are training more and more people. The Merck Foundation is helping us do that, but we've equally started a postgraduate training program. For the first time in the history of this country, some of the trainees are here. Already we have over 100 resident doctors who are training in various aspects in surgery, obstetrics and gynecology, and the rest of them. So that capacity building component is very, very important because that's what is sustainable. Now, of course, these trainees will conduct some thesis research and so on and so forth, which is also very important. But the Gambia, you all know, is a hub for research when it comes to the work being done at the Medical Research Council at Fajara. Now, Medical Research Council is hosted in the Gambia, and it is Gambians and non-Gambians doing the research there on Gambian subjects. So a lot of research is being carried out here, especially on infectious diseases. And this research output has actually directed the response to treatment in many cases. So clinical research is going on, and some of the research clinicians are seated here, and the research assistants are also seated here working with the MRC. At the level of the core ministry, we have the Directorate of Research, which is working hard, struggling though, I must say, to get service data for us in good time. We are building capacity. The capacity is inadequate, but some of the work they are doing is actually advising us in doing what we are doing. We had the Demographic Health Survey 2019, 2020, that has gone ahead to show us what the health indicators are now, which we believe have gotten better from the service data. So our HMIS equally, we're using it as a research tool because it generates data for us. And when that data is analyzed, it goes ahead to help us to know what the indicators are. From that information, we are able to say categorically now that even the maternal mortality ratio has gone down dramatically as I speak to you. So a lot is happening, Honorable Appendi, with regards to capacity building, with regards to health system strengthening. And of course, we cannot continue working blindly. Our activities should be evidence-guided. They should be evidence-based. And this is the thinking. Whatever we do, we say, what's the reason? What's the rationale behind this? And with this strengthening capacity, now for the future, what we intend to do is to get more collaboration between our research directorate and the Medical Research Council, in Fajara, to strengthen the public sector capacity. Thank you very much.
Thank you very much, Honorable Minister. And from the health sector, we move to the education sector, which actually is responsible for the actual training of the doctors. Now, Honorable Dr. Habibatu Drame, I'm aware that the Gambia has an education policy that prioritizes accessible, equitable, quality education guided by the National Education Sector Policy 2016-2030. And this actually is aligned with the Sustainable Development Goal 4. Now, as a Ministry of Education, could you kindly tell us what the ministry challenges could be in trying to encourage the doctors to engage in research? Because I believe the challenges faced by my country are similar to the challenges faced by even the Gambia. We train so many doctors, but when you look at those that engage in research, the numbers are actually very few, close to less than 30% actually engage in research. So what is it? What challenges do you face in promoting research here in the Gambia amongst the scientists?
Thank you, Honorable Minister, for that question. I want to join colleagues to appreciate and thank the Merck Foundation for extending the 12th conference to the Gambia through the patronage of our First Lady, Madam Fatuba Barrow, whose work in this country stands out in terms of support to the medical field as well as to education. I also want to appreciate my presence in this panel and acknowledge the presence of my colleague, honorable ministers, delegates from different African countries and from the medical profession, senior government officials. I am very happy to participate in this panel. In fact, when I was informed about this program, I made a lot of reflection. I know this conference to be skewed to the medical profession more than education, but by far, the Merck Foundation has done a lot in the supporting education in the areas of training and supporting research, especially in the medical discipline, and I'm sure in other scientific areas. I am the Minister for Basic and Secondary Education. So I'm the minister responsible for the foundational education of this country. Yes, research is important, is critical, is fundamental in this sector because it can support us in policy decision making, because then we will rely on empirical data, which is more critical and responsive in the solving issues that we face as a country as far as education is concerned generally. So research at the level of higher education continues to be critical in our nation building, and there is a lot that this country has done to support research in the form of the provision of grants and also through collaborations with other universities. The challenges, of course, remain. We have a lot of challenges, and I think those challenges, to some extent, have been addressed through this kind of foundation, the Merck Foundation, that has come to help in the areas of medicine, as well as in other areas in provision of scholarships and maybe other support, and in resourcing these disciplines to ensure that the officers who provide the services do it effectively and efficiently. I just want to say that when it comes to education, I have a very strong belief that if we are able to strengthen the foundation where it all begins in terms of extending especially in the teaching and learning. For example, within the Ministry of Basic and Secondary Education, we have the STEM areas, the sciences, and the challenges majorly has been limited educators to teach the biology, for example, the chemistry, and the other science disciplines. So if we are able to continuously get support to strengthen the educators in this area, we'll be able to fundamentally stand a better chance in producing young people who are prepared to take up career paths in the medical field. So this is a challenge that the country faces, and hopefully we will continue to collaborate with other sister ministries in our multi-sectoral engagement to ensure that we strengthen this area. It's also very key and important that as a country, we still have challenges in the areas of extending medical health services to the schools, especially at the lower level, the psychosocial support opportunities, menstrual hygiene programs, just to support especially the adolescent girl child who occasionally go through these experiences and will require some medical attention or services to be extended to the schools. So basically, there is a lot that is happening in terms of progress that we have made also as a country. And I just want to say that education within basic and secondary levels in this country are free. It began with scholarship transfer around 2024 to 2025 to support the girl child, because we had a lot of gaps in terms of access to education when it comes to the girl child. Gradually, this reform was expanded to include the boys. And by far, as a country, we have attained very good progress in terms of access to education. School facilities are available within 2-kilometer radius in every community in this country. And we have attained gender parity, which is commendable as a small country within this short period of time in terms of enrollment of the girl child. By far, at all levels of our education, we have more than 50% enrollment to be the adolescent girls. So this is also commendable. So like I said, the challenges are enormous, but together through this kind of partnerships and collaboration, we hope to strengthen our education system and our medical systems, because these are two critical development arms of every system. When these things are taken care of or taken up very well, there is a tendency that prosperity can be obtained in every nation. I am not a medical practitioner. Like I said before I came here, I made a lot of reflections, but hopefully we will say things here that aligns with the Merck Foundation agenda and the discussions happening around here, and hopefully the exchanges will go a long way in supporting our work and taking us to where we intend to go in terms of development and advancing our different respective countries. Thank you very much.
Thank you very much, Honorable Minister. Maybe just to get back to you, you have talked about, the gender parity in schools, in enrollment. Maybe could you just educate us or tell us whether the completion rate is still the same? Because in my country, and I believe in some other countries, yes, you can attain gender parity at enrollment, but when it comes to completion, you find that the dropout rate, especially for the girls, is high. What is it like here in the Gambia? Maybe you could enlighten us before I move on to the next Honorable Minister.
Thank you, Honorable Minister. Actually, it's amazing in the Gambia. And I feel so happy when I report on this matter because in this country, we have a very good completion rate for girls. And not only good, but by far, they stand out. The last examination results for both WASC and GABEGE, that's the internal exams that we conduct as a country before the student transit to senior secondary, we had 60%, 70% of the top scorers all to be girls. So as a country, within the levels of basic and secondary education, we are doing very well in terms of the adolescent girl succeeding. The challenge, however, we have as a country is the transitioning to tertiary and higher education. Because at the age of 18, in the Gambia, the child completes the senior secondary, and it's the critical age in this country based on the culture and our peculiarity as a country. It is also the marriage age for most young people in this country. So this is the critical time, and this is the critical point that we as a country need to work on to give these girls the opportunities to transit to tertiary and education through the provision of scholarships and other opportunities really that can retain or sustain them in their career paths or the different careers they want to pursue as young people. Thank you, Honorable Minister.
Very impressive. Thank you very much, Honorable Minister, for those insights. As the Ministry of Gender, taking on from that very wonderful presentation from the Ministry of Education and the gender parity, as Ministry of Gender, your role is to ensure that you promote equity amongst the men, the women, and often there's a misunderstanding when we talk about gender. People think we are simply talking about the women. So we are talking about all the marginalized groups. However, as I did indicate earlier, the number of women in STEM remains low. And you are actually aware that the African Union already came up with a threshold asking governments to commit 2% of their national budgets into research. As the Ministry of Gender, what is it that you are doing to encourage the women and the girls to actually engage in STEM, but also looking at that provision, calling upon the African governments to commit 2% to research? How are you, as the sector minister, encouraging the women to actually utilize the available resources to engage in research and generally STEM?
Thank you very much, Honorable Minister. I want to start, first of all, to thank the Merck Foundation for organizing this very important conference, where this morning we listened to the support being provided to our different countries by the Merck Foundation and the partnership that's between Merck Foundation and the First Ladies of Africa. I was lucky to have attended 2 of the meetings before, where I represented the First Lady. So I have an idea as to the sort of work Merck Foundation is doing in supporting African countries through their First Ladies. Thank you for your question. The Ministry of Gender, Children and Social Welfare is one of the youngest ministries in the Gambia. When it was established in 2019, it was established as the Ministry of Women, Children and Social Welfare. When I took over with my team in March, we agreed that we should change the nomenclature to Ministry of Gender, Children and Social Welfare. The reason being, you cannot look at women's issues in isolation. You must look at women's issues vis-a-vis that of men. That being the case, the ministry's name cannot remain as the Ministry of Women. We said, let's change it to Ministry of Gender to be in line with international best practice. And I think this paid dividend because when you're looking at women's issues, they are so broad. But if you look at them in isolation, you may not be able to see the main issues, the problems, and you cannot come up with appropriate strategies to address the challenges. Yes, STEM. We all know that it was almost dominated by our male folk. So what we did as the Ministry of Gender, we did our own assessment and we realized that, yes, the girls are doing excellently well up to grade 12, but majority of them are not in the sciences. There are few girls who do the sciences. And we said to ourselves, one way to make sure that girls opt for the sciences is to make sure that we give them support. So what we do, we have a small scholarship program where we give full scholarship to girls doing the sciences. And the intention there is to bridge the gender gap in science and technology. Girls offering the sciences at university and also higher institutions, we give them a full scholarship. And as we are speaking, from 2022 to date, we have given out 100 scholarships to girls who offered the sciences at tertiary and also at the University of the Gambia. And in doing so, we also make sure that we support their research activities. This is one way that we are addressing the issue. The funding, of course, is coming from ECOWAS. And this also has a history. Prior to that, when we were under the office of the Vice President as Women's Bureau, we started through UNFPA, again trying to bridge the gender gap in science and technology. At the time, we gave to only 10. And we approached WIEC and asked WIEC to give us the best science students, female, from grade 9. They did. We supported them up to university, and they all completed successfully. But then UNFPA couldn't come up with additional funding. So it didn't die a natural death, but we continued to coach and mentor those. So when eventually we became a standalone ministry, we took it up again with ECOWAS, and this time we were able to get good funding. And the project is about to close, but there's going to be a continuation because ECOWAS has been very pleased with our performance. And I have no doubt they are going to give more support for the continuity. But again, one thing me and my team are looking at is to make sure that we don't only support those doing the sciences, but if there are females who want to do research, we should also support them. And this time around, we'll come up with a good justification for ECOWAS to fund females who want to embark on research. You have to remember, these are all fields which are male-dominated. Yes, for the government of the Gambia, my PS is looking at me. In the budget for next year, we missed out on it. But let's make sure that in our budget for the subsequent years, a certain percentage should go to research and for females. I want to inform this gathering that in the Gambia, now we have started program-based budgeting. And we'll make sure that PS listen carefully in the M&E framework and programmatic framework that will be submitted to Minister of Finance next year for the subsequent year. The indicators will capture the number of females supported to conduct research. And we'll indicate a baseline as 0, and the target we'll agree upon later after consultation at senior management, and it will be costed. So I'm making a promise that the 2026 budget, that one is gone, because we discussed this in cabinet last week. Following budget that's going to come, we'll make sure that there is an indication of how much will go towards research. And this cannot be done by us alone as the Ministry of Gender. We believe in partnership and networking. So we'll do a lot of advocacy, not only at the level of Ministry of Finance, but before the time for the call circular, we'll engage all other ministries and try to see how best we can pull resources, and at least we get 2% of our budgets go towards research. And when I say research, supporting women. Here, I'm already advocating for gender budgeting. Last year, when I was talking to the Minister of Finance, and he said to me, next year is going to be program budgeting. I said to him, okay, let's try that one first. But the following year, I'll introduce gender budgeting. So it will be gender and program-based budgeting, through which we can earmark some funds for research, and it will go towards building the capacity of women to conduct research. Thank you very much.
Thank you, Honorable Minister, for those insights and telling us about the gender and program-based budgeting. However, you need to go beyond that. In my country, we felt that simply mentioning that became a song, and it was not a reality at the end of the day. So we had to amend the Public Finance Management Act to include a provision that every sector must actually budget for gender, because gender cuts across, whether it's the road sector, whether it's the health sector, whether it is, ICT. You must actually, we have the Equal Opportunities Commission that looks at the budget and issues a certificate of gender compliance. Without that certificate, Parliament will not pass your budget. Now we are considering having a pass mark, because there is no pass mark. Others, it was just a certificate. So even when it is 40%, yes, the Commission issues the certificate to indicate that yes, you budgeted, but your compliance was at 40%. Now, in the next Parliament, where I believe I will come back as a member of Parliament, I now want to amend that to have a threshold, so that we say if you don't score at 70% and above, then we do not budget. We do not give you financing. We don't pass your budget. Why? Because these are issues that affect all of us. Gender issues look simple, small. But look at how many people consume the healthcare services. Look at how many people use the roads. You need a road from your village to the health center. Children need roads to move to the schools. If there are no roads, for example, in some island places, if there are no roads, how will the children move to the schools, which may be in the mainland? So we must see to it that in budgeting, you are catering. And when we talk about gender, as I said, we are looking at the vulnerable, the children, the persons with disabilities, the women, all the old. So it is not just, please don't look at gender as women's issues. So you need to borrow a leaf from us and look at that gender and equity certificate, which is a must attachment to the budget. So now this takes me to the next sector. The Honorable Minister, Honorable Amini Jabi, the Minister for Communications and Digital Economy. The health sector needs to speak to the education sector. The education sector needs to speak to the gender sector. There needs to be networking amongst all these sectors in government. And therefore, connectivity is very important. Infrastructure is very important. So we all know the key role that the ICT plays today. And I must say that without ICT, it's now an enabler. Without it, life is actually becoming difficult because everybody either has a phone, has a smartphone, and therefore educational messages, health messages, all these need to be promoted to the citizens of the country. So as the key sector minister, what is it that the sector is doing in supporting all these other key sectors that are involved in promoting health, but also STEM as a whole? I know that the digital economy is also in that same bracket of the sciences. So what is it that the sector is doing, and what are some of the challenges that you may be facing in trying to ensure that there is networking amongst these sectors, not within the Gambia alone, but within Africa and beyond?
Thank you very much, Madam Honorable Minister. May I also stand on the existing protocols by first recognizing the importance of this very occasion and the role and the importance played by the dynamic First Lady that we have in this country and her colleagues to really be here today and be part of this process that really is linked to the wonderful activities of the Merck Foundation. To them all, I say a big thank you. Let me first observe what I'm seeing here. It's one of the few gatherings in which I can simply say there are more women than men. I think that's impressive. And by extension, if you look at our health sector as well, especially in the nursing area, there are more women than men. I think the minister is here, I can confirm. Just what the Minister of Basic and Secondary Education did not say, and I can boldly say that, if you go to most of our classes now, when you are counting the best 10, the first 7 or first 8 are all women. That speaks in volume. Representing a sector today that we have, I just have one question, but you don't need to answer as I go ahead with the challenge given to me. But we live in a world now that none of you or none of us can do anything without the sector that I represent. From the morning before you go to the bathroom, as you dress up, we are there with you. You get down to the car to walk, we are there with you. You go into the farm or the rice field, we are there with you. Even in the office, we are there with you. Whatever you do out there, we are there with you. And when you come back, even in marital relationships, we are there with you. When it comes to child caring, we are there with you. This sector is witnessing what they used to call transformation. Today, we are seeing some series of transmogrifications. Lives have been changed. Governments, institutions, businesses, individuals, name it. It's even impacting on the global politics today. Understanding that as an achievement and a challenge, what are we doing as a ministry in the Gambia? Well, we're doing a great lot of things that we learn from many countries. May I say with aplomb and satisfaction and happiness and pride, let me say it, that a few of us have lived almost 10 to 12 years of our life in your country, East Africa. We've seen the great strides there. A lot of achievement in those parts of Africa. We are bringing back home some of those things. But of course, since this is about research and capacity, we have to ask ourselves at the African level, then I come down to the Gambia. What is research and research capacity? Because today you will see most of the definitions. There are plethora of definitions of this term, research and research capacity. But up to today, as I speak here today, you will not find a common definition that is universally agreed upon. And the lack of that common definition impacts on our approaches to this very theme of research and capacity building. And at the African level, it is true, like the moderator said, 2% of our GDP is for research. But if you look at the science, technology, and innovation strategy for Africa 2024, within the 2063 African strategy, even there, the original target is a 1%. But how many of us as countries in Africa are actually closer to that 1%? 1% of your GDP to put into research. You can say a few. You go to South Africa, it's about 0.62. You go to Rwanda, it's about 0.65. Possibly, maybe Egypt, 1%. That's the first challenge we have. So in the Gambia, what we are doing as a ministry, based on the strategies we have in place and the policy documents that we are having, we are strictly trying to carve out a way to at least going below or above that African target. Unfortunately, today, the continental target line that is being spent on that capacity is about 0.45%, which is below the global average because the global average is about 1.7% of the GDP. These figures are very important because they are targets. What are we doing? Now, with Africa representing 14% of the global population, 14%, and the Gambia, we represent about 0.30% of that population. Almost less than 3 million people. The first thing we are looking at is what do we need in these areas? And these are the policy and the legal framework for research, the institutional arrangements for research, the infrastructure for research, and a special treatment or special categories like women in research. To start with the policy framework, we have already come up with a domestic STI policy document, which is with us in the process of implementation. That is science, technology, and innovation. That is informed by what the African STI Strategic Document 2024 is actually containing. Now, when it comes to policy, interestingly, I don't know whether it's by coincidence, but the ministries here, education, gender, health, are so pivotal within that strategic document because we have outlined a number of activities for accomplishment. When it comes to the infrastructure, I will go to the general and the specific. The general infrastructure, you'll be surprised. I have seen what happens in Uganda, in Rwanda, in Burundi, in Tanzania, as well as in Kenya, because I live in those places for almost 12 years, working within the same sector. But our case is so unique because you have 3 million people less, our population. But how many infrastructure and service providers for ICTs do we have in this country? You'll be very surprised. Licensed ones that are currently running out. They are currently operating 6. I know you have your MTNs down there, Uganda, Tel and the like, but here we have 6 operators who have laid down their networks. Plus, when we say operators, GSM and fixed line, then ISPs are in good number, 8 to 9 or 10. The strategy is simple. The entire length and breadth of this country, for you to build that infrastructure for research, you need the right connectivity. So we have a national backbone that covers with fiber almost the entire length and breadth of the country. And all these operators have a point of presence on this backbone. The competition is high, the deployment is high. Of course, there are some challenges. But of course, you look at now the international dimension. You have the domestic, you know to go international so that your research network that I'm going to reveal to you soon, it gets connected. Internationally, we have one challenge, and I think I need to draw our attention to that, our connectivity to the rest of the world. We have only one submarine cable connectivity. The Gambia is connected to the outside world with only one submarine cable. That is risky. It's just like how Uganda was able to address its own challenge in those days because a landlocked country, not on the coast, just like Burundi and Rwanda did. And I was there when they did it. So we are really looking at those options of having at least minimum 3 connectivity. But let me also say, in the Gambia, we already have set up what we call the Gambia National Research and Education Network, GAMREN. For this GAMREN, we have spent millions. As I speak to you, 2 things are happening. We have spent millions to have GAMREN get connected to the other outside research institutions, especially at the African level. And at the African level, we call what you have WACREN, That is the West Africa and Central African Research Education Network. We have already paid some good millions to have Gambian connected on that network for the next 5 years, so that research is promoted. And then above that, we have also, right now, Gambian, the Wakren site is live. At the GSC, we call it the Gambia's landing station. Now, at the governmental level, what we are doing very briefly and quickly, we all know all governments are going in for e-government implementation networks. That is in the forefront. And who is leading this is a woman, a lady. And that is just by our own design, to make sure that women are pushing. And let me say clearly and with some satisfaction again that our entire e-government framework, a component of which is also centered on research, how to facilitate research within the government itself. This is being led by a woman in the ministry. So these are things we are pushing through. Of course, we have general challenges, but because of time constraints, I may not be able to dilate much on all of it. But I can conclude by saying that all this research and everything that is happening today, without the proper ICT infrastructure, clear policies and strategies, we will not be there. But we have, as Africans, we don't have to be mere beneficiaries now. That's a challenge. I think we've been beneficiaries of some of this research for so long. We should be part of the research itself ourselves, doing it. That is something we need to focus our attention on. Thank you very much.
Thank you very much, Honorable Minister. Yes, we need to be involved ourselves as Africans in all this. We have our challenges. Let's find the solutions within us. So time is not our best ally. I do not want to encroach on the time for those who may want to go and be with the crocodiles. So may I now, can I take it that the ministers did an excellent job? They were simple, and this is what we all want to see. Research STEM is a complicated issue. However, we have explained it in a simple way, and everybody is satisfied with what is happening in the Gambia. Can I request the Ugandans who are here to stand up? Thank you very much. Yes, we have 4 Ugandans here, but Merck has supported quite a number of them. And we want to appreciate Merck Foundation for that support. They are in different fields. Thank you very much for being here. So, Honorable Ministers, beginning with the Minister of Health, your parting shot, hearing from the other ministers, and considering that as we speak, while research is an education issue, you know that at the end of the day, it's actually your sector that actually is the most affected. I talked about the infectious diseases, I've talked about the non-communicable diseases, and of course, I also talked about the few doctors, the few who are qualified that actually engage in research. So your parting shots on this subject matter.
Thank you very much, Honorable Sarah. First of all, before I go further, I just want to remind the audience that also don't forget that you have sons. You have sons. I can see you want the girls to get everything, isn't it? Your sons are also your responsibilities, isn't it? You know, I think we want 50-50, because otherwise the gender minister will now have to do reverse thinking, trying to address the issue of the boys. So I think we balance it, we encourage both, so we have 50-50. Fair enough, isn't it? We also know that even the doctors now, we're getting more female doctors than, but I think it's good to support the women. We've seen their performance, we've seen what they can do, and they've been left behind for too long. So we actually advocate for gender equity in all the sectors, and they need to be given the support that we can anytime we can for many reasons, and we support it. But let's not also forget to support the boys. That's just the message. Thank you very much, Honorable Minister and distinguished colleagues. I think the partnerships, the collaboration is very important, even at our level, intergovernmental, intra-government collaboration between the sectors ourselves. And now that this meeting has taken place, this panel has spoken, I think internally, we ourselves, we need to talk. So that research thinking is started early in primary school. Problem-solving situations. Let the pupils in primary school deal with simple research problems so that the research culture is inculcated as they go through high school and as they go through university. In university, it's mandatory for people to produce some document, research document, thesis or so on. But typically speaking, that is just because it's an obligation for them to do to graduate. So the inculcation of research culture in our people, I think the honorable ministers here, we will sit internally to discuss this. But I think what is lacking in many African countries, even between the African countries, we do not collaborate much when it comes to research work. Scientists in Ghana, Nigeria, Gambia, Uganda will do their own work locally. But I think we need to have database of scientists across Africa. We know what they are doing. We collaborate, exchange ideas, collect the data, and make analysis, because our people are similar, especially in the health sector. The genes of Africans are similar, so the problems are similar. So if we collaborate, our people will get the best of results, and we can complement each other's efforts. Too often than not, correct me if I'm wrong, but the typical African wants to work in, we want to work in silos. We don't want to come together and complement each other's efforts. And I think we can do that. And I think the Merck Foundation, the alumni we have here, it's an opportunity for you to collaborate with others. You yourself, you can think of research topics. Research might not be so difficult. There are a lot of untouched areas when it comes to research in the health sector in this country. So my parting shots are that I think this will serve as a motivation for us to look inwards. One big problem is financial challenges, but some of the things that we typically need to document, and as I tell my colleagues in the Directorate of Research, I say for some of the things you just need your knowledge, some paper and pens, really. That's all we need. We have research questions, we develop methodology, we collect the data and analyze. Because I guess many of us already have some of the knowledge. So we just need to show the interest, and where we need resources, we try to get the resources, but typically some of the things we just need our knowledge, paper and pen, and maybe some computers to do whatever we are doing, and most of those we have. So thank you very much. I thank my colleagues for all their participation, and I think we need to collaborate intra-governmentally, and then thereafter we can collaborate with others. Thank you.
Thank you, Honorable Minister. Yes, the Minister for Basic Education, your parting shots, and of course, taking off from the Honorable Minister of Health. There is over-reliance on funding from development partners for particularly research. So your parting shots on this, and if you can simply address that aspect on local financing.
Thank you, Honorable Minister. Yes, so as Honorable Dr. Samate puts it, I think the way forward is a collaboration, and he made it very clear that we need to begin in-house, and I think I fully support this. ministerial collaboration is key, especially between health and education. In fact, we're thinking of integrating the health information system with the education information system to be able to understand truly the realities on the ground in terms of the child when it comes to access to education, those who are in school and those who are not in school, especially if they reach school-going age. This is important. When it comes to the national budget of the Gambia in the areas of education, I think, if I'm not mistaken, in 2025, the national budget spending on education is a little over 14%, which is very close to Global Partnership for Education recommended standard of 15 to 20. So as a country, in the areas of education, I think we are progressing, and it is quite promising. Research, yes, continues to be a critical area that we need to continually support and resource. Like I said, it's critically important to depend on empirical evidence in addressing some of the challenges that our respective countries face. Even the challenge that we have in terms of representation of women at the high level, research will be able to reveal some nuances in that area that consequently can help our interventions in addressing the challenges we face as Africa and as African countries. So by far, we have all done, I think, very well, and these collaborations should continue. Research, especially in the areas of research, and also strengthening, like I keep saying, we need to continue to strengthen our educators. Yes, I understand and I quite appreciate that at high levels, the strengthening of our different institutions is key, but if the foundation is not laid properly, then the sustainability becomes a matter of big concern. Like as a country, we continue also to depend on external support in our medical area. We have a lot of foreign doctors that are in the country complementing the efforts of our own doctors. But if we are able to spend a lot of money to train our own people and begin from the grassroots where it all starts in terms of education, I think this is more sustainable for our countries, and hopefully we will go to those levels together. I want to appreciate Honorable Minister from Uganda and Honorable Minister Samate really for the invitation, and we are very happy to collaborate with everyone, especially representative from the Merck Foundation. I was particularly excited when two programs came out from the interventions of the first ladies of the respective African countries, and these two areas I want my Honorable Minister of Health to take note that I'll engage him later on. And that first area is the program on Educate Linda. I think this is a program that needs to be extended to the Gambia. There is also this program of stories that now have been digitalized, that is supporting literacy within the basic education of, I think, the other sister countries. This is also a program and intervention that the Gambia should tap and maybe contextualize it, because that is what I always recommend. We need to conceptualize ideas and programs that we learn from other contexts to resonate very well with our realities and with our context. So this way we will continue to enhance our education sector and support our young people to contribute meaningfully in nation building. Thank you very much.
Okay, thank you very much, Honorable Minister. And we get to the Minister of Gender. Your parting shots, and considering that there is a call for from the Minister of Health that you shouldn't leave the boy child behind. So your parting shots on this subject and ensuring that there is equity and nobody is left behind.
Thank you very much. Um, well, at the Ministry of, it's the reason why we changed the nomenclature from Ministry of Women to Ministry of Gender. So we look at both sexes. We don't work in isolation. We look at how issues affect women vis-a-vis how they affect men, boys, and girls. So we don't work in isolation. We look at both genders and try to see what are the issues affecting them and how best we can address them together with other institutions. Because again, we don't work in isolation, we work in partnership with other ministries, CSOs, and other development partners. But I also want to look at the issue of research. Here, I'm looking at it from my background. My background areas are gender and programming. In programming, you cannot work out of the blue. You cannot work in isolation. Your programming must be based on empirical evidence. And where do you get that from? From research. Research will give you the challenges and also the data. That data you will use as your baseline. And based on that, you develop your programs and you set targets for yourself. Targets can be at different levels depending on the issue at hand. It can be immediate, medium term, and long term. Based on which you develop your programs and then you identify your resources, both human, technical, and finance. Sometimes technical can also be human. And then as you implement, and then based on, and then you develop your programming and M&E framework, results framework. You implement, and as you are implementing, you are doing the monitoring and supervision. And eventually, you do your midterm and end-term evaluation to see how you have progressed. Based on the outcome of which, you can come up with more designs, because when you do your evaluation and you see that you are not reaching or you haven't achieved your target, then you do another assessment, which is another form of research, to find out why you have not achieved that. And based on the outcomes, then you come up with more appropriate strategies for your programs and you move on. We don't leave boys out. We can never leave boys out because after all, it is the Ministry of Family. My ministry is the Ministry of Gender, Children and Social Welfare. But whatever work we do, we make sure that we address both genders, male, female, boys and girls. Yeah, because it takes two to tango. If we support and empower only the women, there will come a time when what we have now will continue to exist but in a different form. There will be coming up with a strategy to address the needs of men. So this is the reason why when you are working, we work taking both into consideration, not leaving the boys out or not leaving the men out. We are aware that both should move together so that for the women, we are able to achieve, and the girl child, we are able to achieve equity and equality. The reason why I said the girl child is because when you look at other issues as well, it is more the girl child who is affected most. But then that doesn't mean that the boys are left out. After all, the Gambia is made up of men and women, boys and girls. Thank you very much.
Thank you, Honorable Minister. The last time I checked the statistics for the Gambia, I think 50.2% were women. Unlike us, 51%. So there are slightly more women than men in the Gambia. Slight, it's a slight. So that takes us to our last panelist, the Honorable Minister Honorable Amini, superintending over a sector that is very important for economic growth. And as we talk about the South-to-South collaboration, your sector is key. Your parting shots, Honorable Minister.
Thank you very much, Honorable Moderator. To the Africans, we can build our national research, education research networks. We can also build our regional education research networks. But I think it's also important that we have them integrated. And the baseline needs to be one data center or 2 or 3 that serves Africa. I do not have to look for Rwanda's data on research and be given that particular data in London. I do not have to be given the access by a code from Switzerland. It's time we look at that. The world is changing. If we allow that digital domination to go and rise to a point that we can't control, that's going to be the end of everything for us. That's one. ICT is no more an enabler. We in the Gambia call it a super infrastructure. Our sector contributes 25% to the national revenue we are collecting. And it employs more than any other sector. I can say this for records. And the same thing goes for all other African countries if we are very careful, look at the statistics carefully. So we need to be attentive to it and treat it as a super infrastructure. Lastly, whatever we do today as governments, whatever we do today as businesses or as people, we know there is a stark difference even between companies that actually apply and invest more in research and development than those that do not. So Africa's research and our national researches, the research subjects, the infrastructure you use, that definition and the control, it is high time we take the control and we define what we want as Africans. Thank you so much.
That brings us to the end of this panel. Thank you very much, Honorable Ministers.